It is Thursday, which means we are getting our biggest COVID questions answered with Dr. Ruth Berggren, infectious disease specialist from the Long School of Medicine at UT Health San Antonio. Doctor, thanks as always for taking the time. We're going to talk about where you are coming up in just a few minutes, but I want to start with the topic of booster shots. We know we're still trying to get people to get out and get their first dose of the vaccine, those who haven't gotten it yet, but we're hearing from viewers who are now 6 months or close to it. They're 6 months out from being fully vaccinated. So they're wondering, are they going to have to take a booster shot? Is it time for that? What do we need to know about that topic?
So everybody should stay tuned for more information soon. All of us think that there will probably be a need for another shot, another booster shot, and it will probably be about a year after you got your first one. So far, we haven't gotten any specific instructions on that, so please don't start coming to our vaccination sites for a booster just yet. The other thing the public needs to know is that it does not help to go and get an antibody test to try to decide if you need another shot. There's no correlation and there's no guidance to use antibody testing to determine the need for another shot. So the bottom line is you're probably going to need a booster, not just yet. Hold on, probably about a year after you got your first shot.
Dr. Berggren, I want you to talk first of all about where you are and what's going on. And secondly, I want to talk about the fact that there are some states and cities that are giving incentives like a lottery, that you can win if you get vaccinated. You can take a couple laps around Talladega Speedway if you get vaccinated. Do you think those things are helpful, and would you like to see something like that here?
So I wouldn't want to incentivize our whole population to just wait until someone comes with a check to have them go and get a vaccine. I think the real reason to go get vaccinated is we want to be protected. We want to get ahead of the mutant variants. We want to get to herd immunity. We're not there yet. We're approaching it. These are all the reasons. We want to protect our families and our loved ones. But for those people that just kind of haven't gotten around to it and they just need a little extra kick in the pants to go get it done, I don't see anything wrong with an incentive. It would only be a problem ethically if the incentives were not distributed fairly amongst populations, or if the incentives were so high that people who are poor feel like they can't refuse it, because that becomes then coercive.
Doctor, talk about where you are right now. What's your mission out there this evening?
So I am part of UT Health's Mobile Vaccine Administration Unit. This is an effort that all of us are really putting a lot of energy into, and we're quite proud of. And we partner with people in the community, people that we have ongoing relationships with, or people who reach out to us. So today, as you can see from what's behind me, I'm at the Now Word Covenant Church on Nacogdoches. And I was actually invited to come here and provide town hall information to the congregants. I was here with my colleague, Dr. Lark Ford from the School of Nursing, and we did a town hall meeting with people from this church right after their church service this past Sunday. And then we were invited to come on site, and we're doing a vaccine drive-through. So I'm indoors in the air conditioning. The vaccine is actually happening out under some canopies in the parking lot of this church. And we have a nice shaded place for the vaccinated people to sit and wait after they've had their vaccine. We've got nurses, and we've got our UT Health van, and we're giving Pfizer, which means that we'll be back here in 21 days for the second dose for everybody who got vaccinated here today.
That's exciting. I want to get quickly to some of the questions that we have for you. Do vaccinated 80-year-olds need to be more cautious about unmasking and distancing than others, than the rest of the population, I guess that asks?
So if everybody remembers the CDC guidelines for what's safe and not safe, vaccinated versus unvaccinated, the color-coded charts that's circulating, they don't have any distinction by age. So there is no specific guidance about people that are older than 80, but I'll tell you, some research is coming out and has been published in very credible infectious disease journals looking at the titers of antibodies. That's the immune defense that's elicited by vaccine, and it looks like those neutralizing antibody titers are lower or less likely to be elicited in the elderly, in people over the age of 80. Now, that's not the only parameter that matters, and there's other forms of immunity besides neutralizing antibody. There are cell-related immunity, but it makes us be a little concerned that we need to watch this older population very carefully. We know that there are some less healthy immune system people, like people with solid organ transplants, for instance, who are not fully protected from the vaccine, and other people who might be on medicines that suppress the immune system. Those people might not get fully protected from the vaccine. What this means is we should be careful around those people. So if you go to the doctor's office, you know you're going to be around older folks, around people who may have cancer, who may be immunosuppressed for many reasons. We should all be wearing our masks around those people, and we need to be watching. Remember, we're not very far into this whole vaccination story. I got vaccinated in December. Hasn't been a year yet. We're still learning. But we worry that older folks or people who are immunocompromised may have less protection from the vaccine than the rest of us, and it's one of the reasons why we want to wear our masks when we go to doctors' offices as well as hospitals and nursing homes.
And Doctor, I want to ask you about what we continue to hear about coming out of India, just the incredible challenge that they are facing with COVID-19. And we know that we've seen what's played out in other countries make its way to the U.S. in some cases. So is there an issue with possibly what's happening in India, the variant there, affecting us here in San Antonio?
So it really should be a concern. I'm happy to report that India looks like they peaked in terms of their surge, their current surge around the 6th of May, and things are beginning to come down. But coming down still means they're having more than 250,000 new cases every day, and they're having ongoing high numbers of deaths. And the reason that we think this is happening is that they have a mutant variant that appears to be more infectious than the earlier types of virus that were circulating. The India variant has been reported in the United States, not everywhere, but in a number of states where they've been looking for it. They're doing genetic sequencing. So that means that we could, in fact, see the India variant here. Good news, vaccines protect against the India variant. Bad news, this variant is more infectious than the COVID we're used to seeing, and it could wreak havoc in the unvaccinated population. So come on in, everybody, and get vaccinated.
Just another reason to. Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio. As always, we appreciate your time.
Glad to be with you.
We'll be right back.